I really, really hope that someday that I can go without having to wear makeup. It's really difficult to talk about, but that is just what I really hope for someday. Instead of having to hide behind 2 layers of makeup and hide from people 2 hours every day while I'm putting on the makeup. I have a pigment disorder called melasma, and I've been suffering with this disorder for about 5 years now. It's really just a big blotchy brown mess on my skin. There's a lot of white blotches. It kind of looks like just a crazy version of some freckles. It's just such a pain. I'm afraid to take off my makeup in front of my roommate. If I ever stay over with my boyfriend, I don't wash off my makeup. I'm too afraid to show my real self in front of him. I've been seeing a dermatologist for a long time. I went through Roaccutane, bleaching creams, chemical peels, laser treatments, and I'm not seeing any results from anything. When I wake up, I'll wash my face, and then I'll follow up with an Axone acne cream, and then I'll cover my face with 2 coats of high pigment foundation, and then for the really troublesome areas, I'll use a concealer. So I have to spend 2 hours putting on makeup before I get up in the morning and go work out, or swimming and surfing because my makeup will wash off in the water. It's a frustrating thing to have to deal with, and I don't want to have to hide for the rest of my life.
Christina joins us now along with board-certified dermatologist Dr. Sonia Batra. And Christina, I know that this isn't easy because you're here on our stage and everyone realizes this without makeup.
Yeah, this is hard. The only person that's seen me without makeup is my mom. So this is very difficult. And I hope that sharing my story will help others with the same disorder.
And for the record, I'm a very honest person, and I know you're dealing with the skin condition, but you're beautiful.
Thank you so much.
You are. And Dr. Batra, a blessing nowadays, and this is why you're here. Obviously, you have the beautiful technology of laser,
Absolutely.
which can really help. Now, you already have numbing cream on, do you not?
Yes.
Okay. So why don't you talk us through, as you start
Sure.
treatment on Christina, what this treatment does?
So absolutely. So Christy, I'm going to have you come back and just lie back. And so this is a fractional CO2 laser. And Christy has tried kind of the really common things that are used for melasma, which include fading creams, chemical peels, some of the lighter lasers that are non-ablative, that don't really take off that top layer of the skin. This is a laser that has a slightly longer wavelength that penetrates a little bit more deeply, and it's absorbed by the water in the skin. So it actually heats and takes off that top layer, which contains all that excess pigment. But the interesting thing about melasma is that even though this is meant to be sort of a one-time or a very, very rare treatment, it can often come back, so anyone with melasma having any sort of treatment has to maintain with a fading cream. And then the other aspect is that it's so critical to use a broad spectrum mineral-based sunscreen, because we do think that there's a strong component of heat in melasma, and some of the chemical blocks can trigger heat.
So let's go ahead and cover up. We're going to cover up Christina's eyes.
You can work and answer questions both at the same
Absolutely.
time, right?
And the reason the cream is on is just because lasers can be a little painful.
It's like a little
Absolutely.
snapping
So
snap
Christy, I'm
with
gonna get started here.
with
So
a
I'm gonna
rubber
do the
band.
first
And
part.
Sonia, in this particular case with Christina, I mean, you're treating with a fractional CO2, correct?
Exactly. So we're trying to target both the pigment as well as some of the divots and texture change that have occurred from the acne she's already had. So we're really just trying to very carefully do a single pass here. And the reason this is safe in this context is because it's absorbed by the water in her skin, and it's a longer wavelength laser that's going to really just cause her to peel off that top layer that has the excess pigment.
So what are we seeing happen to the skin as you laser that?
So the big advent in this is that it is fractional, and so it's almost like a grid pattern if you look closely. And that's because we're leaving islands of the skin that aren't being treated or heated by the laser, and that really expedites the recovery and makes it much less likely to cause any additional pigment change or any scarring.
And so after this, obviously, she's going to have to be careful out in the sun for a while. There's going to be some you know, some residual effects. And while we let you finish, I just want to ask, see, how does it feel?
It's not bad.
And as far as emotionally, how does it feel to know that you're on the road? You're on the road to clearing up your skin.
I'm so thankful, so happy.